my name is Nehal Kanade and my today's topic is the blood pressure. The blood pressure is a common condition that affected to the bodies of the arteries. It also called as the hypertension. If you are a high blood pressure, the force of the blood is a pressing against to the artery wall and the consideration to the consistency to the high, and the heart was to work harder to pump the blood. The blood pressure is measured in the millimeter of mercury. In a general, hypertension is a blood to pressure a reading of the 130 to 80 millimeters of mercury or the higher. The normal blood pressure is a category of a normal blood pressure. The blood pressure is lower than 120 to 80 millimeter mercury of higher then the elevated blood pressure. The top of the number range between 120 to 130 millimercury higher than the bottom number is below is not about to the 80 millimeter of the higher. Then the stage of hypertension. First, the top of the number range is 130 to 139 millimeter mercury higher of the bottom number is 80 to 89 millimeter of the higher. The stage 2 hypertension is a top number of 140 millimeter mercury of higher is a higher to the bottom number is a 90 millimeter of the higher of the blood pressure is a 180 to 120 millimeter of mercury of higher. It is the consideration to the hypertension is a emergency to the crisis. The emergency medical help for anyone this of the blood pressure number. The high blood pressure is a increase the risk of the heart attack, stroke and other serious health problem. It important to the have of blood pressure check at every 2 years. Most of the high blood pressure have many symptoms. Even if the blood pressure is reading reach of the danger high level, you have to the high blood pressure for year without any symptoms. A few people with a high blood pressure may have headache or shortness of breath, then the nose bleeding. Blood pressure is a screening is an important part of the your overall health, and it is the general health care, and you should get the blood pressure check depend on your age and your overall health. You provide as a blood pressure reading at least the every 2 years at the starting age 18. If your age is 40 or older than you are 18 or the 39 of the high risk high blood pressure, ask for the blood pressure check every year. Your care provider will likely recommended more frequent and reading. If you have to high blood pressure or other risk factor of your heart disease, the children's age of the 3 and older may you have to the blood pressure measure as part of their the yearly checkup. If you don't regularly see a care of the provider, you make to be the able and get to the free blood pressure screening of the health resource and the other location of your community. The free blood pressure machine are also available in someone's store and the pharmacist. Blood pressure is determined by the two things: the amount of the blood and the heart pump. The how hard the how hard if is the blood pressure move through the arteries. The more blood pressure of the heart pump and there the narrow of the arteries, the higher the blood pressure. There are the two main types of the high blood pressure. First is primary hypertension, is also called as the essential hypertension. Primary hypertension is for most adult, and there are the identifiable cause of high blood pressure. This type of the high blood pressure is called the primary hypertension, and the essential hypertension, it tend to the develop of the gradually over time, and many years of the plug to the build up in the arteries called the other osteocysts increase the risk of the high blood pressure. Secondary hypertension, this type of the high blood pressure is caused to the underlying condition. It trend to the appear and suddenly to cause the high blood pressure, that does to the primary hypertension condition, and the medicines that can be lead to the secondary hypertension included, such as the adrenal gland tumor. Then the blood vessels problem, it is present to the birth, and it also called as the congenital heart defect. The cough and the cold medicine are some of the pain relief, and the birth control pill. Blood pressure of risk factor, it included the age, then the family problem, then family history, race. The first of the age is the risk factor of the high blood pressure. It increases with the age, and until about the age of the 64 of the high blood pressure is a more common in a male, and human and women are the more likely to the develop high blood pressure after the age of the 65. Then the race, the high blood pressure is a particularly common among to the black people. It develop in the earlier age of the black people, that it does in the white people. Family history, you are the more likely to develop the high blood pressure if you have to the parents or a sibling with the their condition. Then the obesity to the being of the overweight, then excess the weight cause of the change in the blood vessel and the kidney of other part of the body. This change to the increase blood pressure and the overweight, it having the obesity, and also raise to the risk of the heart disease and the risk factor such as the high cholesterol. The excessive pressure to the artery wall, it cause to the high blood pressure. It can damage the blood vessel and the body organ. The high of the blood pressure and other longer, it goes to the control of the greater to the damage. Thank you.